Yeah, I've always had this question. I never ask anybody, what's the difference between insomnia and sleep apnea?
Well, insomnia is that you either can't get to sleep or you're waking up after a period of time in sleep. Sleep apnea is a disorder that actually where you're stop breathing for a period of time
Ooh.
and then come roaring back with like a snoring breath. So a lot of times it's associated with snoring. Much of the time sleep apnea is associated with one of the factors is overweight, because then it creates a lot of fleshy tissue around the throat and the uvula, and it closes the airway. And so there'll actually be a period of time that they're not breathing. And so what that does is it disturbs your normal sleep cycles. And so you're not getting into that deep REM sleep or that deep theta delta brain waves so that you really rest and repair.
So, yeah, and that REM sleep, so I know that's rapid eye movement and what all, but if you never reach that level, then you're not getting proper sleep, is that right?
You're not going to get fully rested. Because that's the purpose of sleep, is to rest the body and the mind. And to, in a way of speaking, go back to source. Mm-hmm. You know, because we shut off our conscious mind for the most part and go deeply into the subconscious mind where we go into our dream state. And it's an important aspect of health in that we then are able to recharge and repair all the damage and the wear and tear that's been done through the day. So that's why we include sleep as one of the 6 essentials for life.
And yeah, can we just review the 6 essentials? I like to do that every time.
Well, it's important because, you know, obviously there could probably be hundreds of things that are important for your health. We like to keep it simple and talk about 6 essentials: what you eat, drink, breathe, exercise, rest, and think. So these are the conscious choices we make every day. And some people more conscious than others.
Well, you know, and some people are unaware that they're eating something that's not good for them, for instance.
Sure, sure. And that, of course, is a factor, but that doesn't mean that through their ignorance about what is good or bad for you, doesn't mean they won't suffer consequences, because we live in a cause and effect universe. So even if you don't know, it's still going to affect you negatively.
Well, all right, how would someone know, say you do have a sleep disorder, you wake up in the middle of the night, you're unrested or you're restless and you have to get up and you can't seem to get back to sleep. How would you know which particular one of the 6 things might be the cause of that? Well,
it is a little bit more difficult to determine which of the specific things, because so many times, again, what we're talking about is looking at a reductionist thinking, because that's what medicine tends to do. There must be one thing, instead of looking at it holistically and saying, there are 6 essentials. Make your best possible choices and really be self-honest and look, what am I not making good choices in? So always, in any condition, there are physical, chemical, and emotional factors that are causative. And
well, all right. So, well, then like for instance, if you're not sleeping well, and you would try some different things, like get a little more exercise.
Yes.
Change your diet from,
Get a more alkaline diet, which we've talked about before, which would help the body not be irritated, because acidity, acid condition in the body, it creates irritation and inflammation. And so that can lead to physical uncomfortableness, could be leading to pain. So now you have a pain condition or you have an injury and that you're not comfortable. You can't sleep on one side. That could be some of the physical factors. The other physical factors could be that you're in a poor bed, could be in an improper pillow to support the body. Those are more physical. You could be sleeping in a room that's not dark enough, it's not quiet enough, it's not cool or warm enough.
Well, you've hit on a couple of things there that I found when I made changes, and it greatly improved my sleep. One of them was early on, I read somewhere that the firmer the bed, the better it is for you. So when my wife and I first got married, we went out and got a big king size, really firm bed. And boy, did I sleep horribly on that. And then she's an acupuncturist, and she was working around the corner from this McCloskey place in San Francisco where they hand make beds for you. And it was a little pricey, but the day we got that, I got the first good night's sleep in a while. And the light thing, sometimes I'll do a KVMR red eye radio show, midnight to 4 in the morning. Yeah. If I don't put eye shades on, I wake up and that's it. Yeah. I don't get the sleep.
Because we're designed to follow natural cycles. We are part of the natural environment, but because of our modern lifestyles, we live unnatural lifestyles from the environmental factors. Because, in the, a couple hundred years ago, the only thing you had to do to light a room was a candle or a gas lamp. Most people didn't stay up till midnight, 2 in the morning watching the TV or sitting in front of the computer, because the computer, and that causes increased brain waves, and then you try to go to sleep. It's like people trying to go to sleep, after watching the news, especially recently. And you watch the news and try to go to bed, it's all this on your mind. So there's the emotional factors, the anxiety, the constant repetitive thoughts that go on that trigger a response in the body that's causing you to be in what's called fight or flight, which we're going to talk about in the talk I'm doing in November about adrenal stress. But basically, that's the type of thing that on an emotional level can affect your quality of sleep, because your conscious mind may be just going wild, and that has already programmed your subconscious mind. So even when the conscious mind turns off, the subconscious can still be determining that there's a threat. And if you're in threat and healing or threat and relaxation are incompatible. So that's one of the big keys as far as an emotional, mental level is, what are you feeding yourself? Because we think about feeding ourselves when we talk about diet, but we don't normally think about our thoughts as being part of a diet. It's something that we're taking in and influencing our bodies. They have each thought has a certain vibratory frequency, which we talked about last month about consciousness. And so we have to look at, what am I doing before I go to bed? Am I drinking caffeine later in the evening? That's another chemical factor. Or sodas, it could be sodas, teas, coffees, those type of things. And caffeine is a chemical stimulant that triggers a fight or flight response. So again, you're chemically inducing something when there is no threat.
What about, I know this is kind of off that particular topic, but when I was younger, we were always taught you should get 8 hours of sleep a night. That's an important, if you get 8 hours of sleep, you're doing fine. But I find that now I don't really need 8 hours of sleep. 6 will pretty much do it for me, and I feel rested and ready to go and do stuff. I'm not sluggish or anything in the morning.
And yet, you could still be in a sleep deficit, because sleep is one of the most important factors in longevity. And,
oh no, I better get more sleep.
And so there may be factors going on that you're not aware of. Most recent studies show that 7 to 9 hours of sleep is ideal. And in fact, back in 1900, most people slept 9 to 10 hours a night.
Well, they didn't have electricity.
Well, that was part of it.
I'm kind of joking, but yeah, it was.
Yeah, that was part of it, because what were you were going to be more focused on with the natural rhythms of life. It got dark. We're supposed to kind of go inward. Light came on. We're supposed to do our day, but we can now, with modern living, our lifestyles are 24/7. If we look at global humanity, because if you're let's say you're the West Coast and you deal with the money markets, you better be up at 4 in the morning so you can converse with those in the East Coast or over in Europe or Asia. So everything is kind of off kilter as far as our natural rhythms.
What kind of things? So I'm saying I get 6 hours of sleep and I feel fine. What kind of indications would there be in my daily life that I might not be getting enough sleep?
It could be later on in the afternoon, a low energy. It could be that you're putting on weight, because a lack of sleep will increase cortisol levels, which will trigger an insulin response. And one of the things that happens, you'll start to put weight on around the middle especially. That's what cortisol tends to do. You could be hungry for fats and sugars because of the stress response. You could be going through periods of depression. One of the things you wouldn't notice as much, but you might have some muscle wasting, because the body produces, the sleep helps you produce human growth hormone. So that's going to be altered. You might be finding yourself getting more colds or flus, you might have wounds that don't heal as well, because immune function is going to be depressed, because a lack of sleep is a stress.
And sleep is when you heal, isn't it?
Exactly. So if you can't sleep, you're not going to heal. And just because you're sleeping doesn't mean you're in a deep enough state to really, truly heal. It's one of the big problems of people that use medications to sleep is they may knock themselves out, but are they really resting? Because resting goes beyond sleep. Even living a life in a restful state is important. Learning how to maintain that sense of centeredness in the course of daily activity, because we've talked about brain waves before. There are theta, delta, alpha, beta. Most research scientists will say that beta is your normal waking state. But really the alpha state, which most people consider more associated with meditation, should be our normal waking state. Beta state means that there's a threat.
So you have more anxiety or something similar to that.
Yeah, you're ready to fight or run. And basically that subconscious part of your brain that runs your body, because you don't have to think, we've talked about this before, you don't have to think to run your body, is basically doing two things, and two things only. It's looking at the input through your senses and asking two questions: threat, no threat. Threat, no threat. If you have familiarity, it's going from the past with an experience, you're going to recognize it, no threat. But sometimes we get stuck in that everything's a threat. Like I was working with a woman just the other day who, because of her upbringing, because of living in an abusive family, that everything now that she interprets that's coming in through the senses, her five senses, is interpreted as a threat.
Wow.
So she's constantly in that threat physiology, which again is going to run you down.
Well, if you have that kind of uh-oh feeling during the day, I mean, how would you get over that? Would you do like you were saying earlier, a more alkaline diet and help to like take that edge out?
If that's one of the issues, it could, or a simple breathing, because breathing is one of the most basic survival needs, and most of us breathe very shallow. When you're in a fight or flight, how are you going to breathe? Yeah. Shoulders up, you're breathing, you're ready to fight.
Breathing at the top of the lungs.
Exactly. So we actually teach a exercise called rhythmic breathing, where you take a 4 count to inhale through the abdomen, hold the breath for 4 counts, exhale to a 4 count, hold the breath out for 4 counts, and then continue that, and that will induce a relaxation response. It creates a pattern interrupt, because you have to interrupt the pattern. There's a pattern going on, interrupt it, and it shifts.
Well, that'll certainly slow you down. Shouldn't everybody be breathing deeply into their lungs, though?
Sure. I mean, that would be a natural state. If you watch a child breathe, they let their belly hang out and they breathe.
Yeah, they're full breath.
They're not thinking about life. They're just responding to life until they start to get wounded.